All right, so in this part of our lectures on mental health, we are going to be talking about schizophrenia. So to begin with, what is schizophrenia? So schizophrenia is a condition that affects approximately 1% of the population. The onset typically begins between the ages of 15 and 30. That's usually when individuals will notice like the first symptoms of schizophrenia. It affects men slightly more than women, and it is the eighth leading cause of disability worldwide. The cause of schizophrenia is unknown. It is potentially from like your genetics and hereditary, but it also could be from environmental factors. So still one of those things that they are trying to kind of figure out what's going on. There are four main categories of symptoms. There are positive symptoms, which would include delusions and hallucinations. There are negative symptoms, which include having a blunted affect, poverty of speech, adonia, and asociality. There is disorganization, which is a thought disorder and bizarre behaviors. And then there's cognitive impairment. And so I'm going to talk to you about each of these and kind of go into more detail in the coming slides. So you'll learn more about kind of what are the differences between these, what do these words even mean, and how would you kind of notice those symptoms. So there's different subtypes of schizophrenia, the first being paranoid schizophrenia, which this type of subtype is characterized by prominent delusions and auditory hallucinations. So delusions are thinking that something is happening that is not actually happening. So one common delusion that people with schizophrenia may have is that people are following them. When they see a black SUV on the highway, they think that that is the FBI and that they are tracking them and following them. And then auditory hallucinations would be hearing things that are not actually being said or are not things that are going on actually in the environment. It is often revolving around themes of persecution or grandiosity. So thinking like big things that are happening, again, that are not actually happening, but without significant disorganization or catatonia. So with paranoid, they think that things are happening and they think that they can hear things. Well, they do hear things that are not actually being said or not actually happening. But they don't have that disorganization and catatonia that you would see in some of the other types of schizophrenia. So that's the biggest difference between paranoid and the other types. An example would be a person with paranoid schizophrenia might believe that they are being constantly watched or followed by the government. They might hear voices telling them that they are in danger or that they must take specific actions to protect themselves. The next type is disorganized schizophrenia. So with this type, it is characterized by disorganized speech. So the way that they are talking to somebody else doesn't really make sense. Like how they're talking, the things that they're saying, it doesn't follow a steady line of like how you would talk to somebody. So it's all over the place, very confusing for somebody to be able to follow. They may also have disorganized behavior, things that, again, that don't really make sense that they're doing, and inappropriate or flat affect. And I mentioned in one of the other videos, but flat affect is when you are looking at that person and they are not showing any emotion on their face. They're just kind of there and present. So that is flat affect. The person's thinking and communication can also be severely disordered. And so a lot with this disorganized, as the title says, disorganized, a lot of confusion, a lot of incoherence in what they're saying and what they're doing. So an example would be an individual with disorganized schizophrenia might speak in a jumbled or incoherent manner, making it difficult for others to understand them. They may also exhibit bizarre behaviors such as wearing clothes inappropriately or not following social norms, and show little emotional response to situations. The next one is catatonic. With this type, there are disturbances in movement. A person with this type of schizophrenia may exhibit extreme immobility, excessive motor action, or peculiar movements or postures. They may present themselves in maybe like a kind of like a hunched over posture, or maybe just the way that they walk. It's disorganized and does not, again, follow that flow that you would see with somebody else. Someone with catatonic schizophrenia, so an example would be that they might remain in a fixed, rigid position for hours or even days without speaking or responding to external stimuli. Conversely, they may also display excessive, purposeless movements or repetitive actions, such as pacing or mimicking the movements of others. The next one is undifferentiated schizophrenia. With this type, it is characterized by individuals who exhibit symptoms of schizophrenia that are not clearly fit into either the paranoid, the disorganized, or the catatonic subtypes. Essentially, it is the catch-all category for schizophrenia that does not have a specific set of dominant symptoms. Some examples would be, or an example would be, a person with this type of schizophrenia might have a mix of symptoms such as hallucinations, delusions, disorganized speech, and behavior, but these symptoms do not align neatly with any of the other specific subtypes. And then the last one is residual schizophrenia. And with this type, it is characterized by a history of at least one episode of schizophrenia, but the person currently does not exhibit prominent positive symptoms such as delusions, hallucinations, or disorganized speech. Instead, they may show more negative symptoms like social withdrawal, flat affect, or a lack of motivation. So when I mention those negative symptoms, so there's positive symptoms and negative symptoms that you'll see as kind of the categories with schizophrenia. Positive symptoms are things that wouldn't have been there without this condition, but are now there. So for example, hallucinations and delusions are something that are added that were not there previously. Negative symptoms are things that have been taken away. So for example, that flat affect, not showing emotions, that's something that was there and was taken away. So that's why it's a negative emotion. It could also be social withdrawal. So again, taking away, instead of talking to people, now not doing that. And lack of motivation. So you can see it's not, when it says negative symptoms, it doesn't mean like depression or sadness, like that type of negative. It's more about something that was there that's no longer there, and positive being something that's been added that wasn't there. So it's not positive like happy and mania and those sorts of things. It is things that have been added that were not previously there before this condition occurred. So an example of residual schizophrenia might be having previously experienced intense hallucinations and delusions, but now they mainly struggle with low energy, reduced emotional expression, and difficulties in social interactions. There are different treatment options that are available, including antipsychotic medications, psychotherapy, and rehabilitation and community support activities. When talking about antipsychotic medications, these medications are basically the cornerstone of schizophrenia treatment. They can help to alleviate some of the symptoms that are affecting that individual and to help in altering the effects of the neurotransmitters in their brain, particularly dopamine. And it helps to manage the symptoms such as delusions, hallucinations, and disorganized thinking. When I worked in a inpatient mental health facility, when somebody would come in that was either psychotic or had specifically schizophrenia, that was the first thing that they kind of helped us to understand that needed to be done, is that we had to balance out the medications and to make sure that we were helping to reduce those symptoms first before providing any additional treatments. Because of the amount of things that are kind of happening to the brain that make it really difficult for that individual to be able to focus or to do anything else. So that was really kind of our main focus at the beginning. was, okay, getting them the medications that they need and giving them time for those medications to take effect before providing additional treatment options. An example of some of the common antipsychotic medications include risperidone, olanzapine, and clozapine. And these, again, can help reduce the severity of the psychotic symptoms and prevent relapse. Next is psychotherapy. So psychotherapy includes cognitive behavioral therapy, as I mentioned previously, and supportive therapy to help the individual to manage their symptoms, improve functioning, and cope with the changes in the effects of the disorder. An example of how psychotherapy could be used, the individual might work with a therapist to develop strategies for dealing with hallucinations, improve their social skills, and address issues like depression and anxiety that might accompany the schizophrenia. And then the last one is rehabilitation and community support activities. These programs focus on improving the quality of life of the individual with schizophrenia by providing support in areas like employment, social skills, and daily living activities. They aim to promote independence and integration into the community. When I was in my PhD, one of the programs that they offered, and I did take some classes in this area, was in rehabilitation counseling, which is more focused not on like rehabilitation from a substance, but rehabilitation in vocational skills. So like a vocational counselor. And so with that rehabilitation and being able to help them to find a job, and even having job coaches that can go with them to that job to help in making sure that they have the appropriate accommodations in place to be successful. And so that's something that can be done as well as another treatment option. General treatment goals, to reduce severity of psychotic symptoms, to prevent reoccurrence of symptomatic episodes and deterioration in functioning, and to provide support to enhance functioning at the highest possible level. Prognosis for schizophrenia, it's dependent largely on the adherence to the drug treatment. As you've probably seen in like movies and TV shows, sometimes it can be really difficult for individuals with schizophrenia to stay kind of compliant with their medications. And so that is something that can be difficult to work with, and making sure that they are taking their medication appropriately every day. It's estimated that about 5% of individuals with schizophrenia commit suicide. Side effects of these psychotropic medications that I talked about, dystonia is a common symptom, and this is a movement disorder characterized by involuntary muscle contractions that causes repetitive twisting and repetitive movements. An example might be a person experiencing dystonia may have their neck muscles contracted uncontrollably, causing their head to twist to one side. The next one, akinesia. This is a type of symptom where there's the loss or impairment of voluntary muscle activity, which can also be seen in Parkinson's disease. For example, an individual may find it difficult to initiate movements such as starting to walk or rising from a seated position. The next one, akathisia, which is a condition of the inner restlessness and an urgent need to be in constant motion. So that, again, that feeling of like, I have to move, I can't just sit here. For example, somebody with this condition or this symptom might constantly pace, fidget, or be unable to sit still for even short periods of time. I saw this one pretty often. And so when I was noticing that the individual was having these symptoms, that I could encourage them, instead of us sitting and doing something, why don't we go and do something where we can be more active and you can walk around and you can do things, and I will help you in kind of processing what's going on. Photosensitivity is the next one, and this is an increased sensitivity to sunlight or artificial light, which can result in skin reactions and sunburns. So for this individual, making sure that you are providing depending on the interventions you're providing, that they're in an appropriate space that would not cause them harm. So not doing things outdoors. Changes in blood pressure may also be affected. Lethargy or feeling tired, weariness, fatigue, lack of energy, and agitation, kind of restlessness and nervousness that accompany that anxiety and irritability. So those are the common side effects of these medications, and just things to look out for and to know if working with this population. Some treatment considerations. So using short, simple sentences can be really helpful, especially if they have delusions and hallucinations, because it can be really disorienting for them. And so short sentences, repeating statements, that can be really helpful in making sure that they understand what you're talking about. Using small talk may be difficult for this individual, more beneficial to use direct information that they need to know. Explaining what and why, and using routines can be very helpful. So what are we doing? Why are we doing this activity or this intervention? And doing so at the same time every single day. Providing guaranteed success experiences. So we are not going to do something that is overly challenging. Instead, we want to do something that can meet their level of ability. Avoid overstimulation. Too much noise, too many kind of stimuli can be very disorienting as well. Identifying stress coping strategies, being cautious with non-reality based activities. These, again, because of the hallucinations and delusions, can be really disorienting because they're already in that kind of disoriented state. Consider medication side effects when providing your treatments as well. So some recreational therapy goals: increase self-worth and self-esteem, increase acceptance or acceptable release of emotions, increase positive use of leisure, and increase on-task behaviors and attention span, enhance stress management skills and independence in activities of daily living, improve communication skills and interpersonal relationship skills, and promote socialization and social skills and community living skills. All right, so the next section is going to be substance abuse.